हाय गाइस, वेलकम टू आरोग्या फिजियो टिप्स। आपका आरोग्या फिजियो टिप्स में बहुत बहुत स्वागत है। आज का जो टॉपिक है बहुत ही इंटरेस्टिंग है। इट्स रिलेटेड विद प्रेगनेंसी से रिलेटेड ये टॉपिक है। जनरली प्रेगनेंसी में आर्म वर्कआउट करना चाहिए। क्यों करना चाहिए? क्योंकि इससे फंक्शनल ट्रेनिंग होती है। इट हेल्प्स इन फंक्शनल ट्रेनिंग बिकॉज वंस यू डिलीवर अ बेबी यू विल बी लिफ्टिंग अ 3 kg weight till 10 to 12 kg for the next 1.5 year. So you should be functionally trained for it. What it can help you? It can help you to better your posture. It can increase your upper arm strength. What else? It can help you in doing all the functional movement like carrying the baby or lifting the baby or pulling something. So all the functional movements can be better if your upper body strength is better. When you should do this? You can do from the first trimester itself. आप पहले ही trimester में कर सकते हैं। अगर आप पहले वेट लिफ्टिंग करते थे, आप अगर मतलब प्रेग्नेंट होने से पहले अगर आप वेट लिफ्टिंग करते थे तो आप फर्स्ट ट्राइमेस्टर से शुरुआत कर सकते हैं। अगर आप पहले नहीं करते थे तो आप अपने गायनेकोलॉजिस्ट या फिजियोथेरेपिस्ट से कंसेंट लेके फिर चालू कर सकते हैं। कब तक कर सकते हैं? आराम से 36th वीक से लेकर 38th वीक तक आप अगर कंफर्टेबल हैं तो प्लीज आप कर सकते हैं। सम ऑफ द एक्सरसाइजेज यू कैन stop at 28th week if you are uncomfortable. So we can start. Now there are some of the rules of doing this arm workout during pregnancy. I will let you know the rules. Now there are some of the things which you should keep in mind before starting the exercise. One, you should not arch your back. So arching involve your core. Your core has to be involved. Your back has to be involved. There has to be one straight posture. Your shoulder and hip at one line and ankle at one line. So one straight posture. Your knee should not be locked. Your knee should be as loose as possible. Okay, so these are the things you should keep in mind. Once you are comfortable, you can start with the arm workout. Let's do some warm up before starting the arm workout. So let's do some diagonals. Okay. Shoulder circles. All these exercises you can do 10 to 15 times before starting your weights. Okay, very important. You can do just the biceps curl and opening up. Breathe out, breathe out, breathe out. Okay, you can do shoulder small circle or arm circle clockwise, arm circle anti-clockwise. All these exercises you can do for 10 to 15 minutes. When you feel that all your alternate hands up and down, all your shoulder muscles, your elbow muscles are completely warmed up, is when you can use your wrist because you will be lifting weights. So up down circle, clockwise circle, anti-clockwise, out in, out in, out in. So these are some of the warm-up exercises. If you want more warm-up exercises, they are mentioned in actually one of our videos. Okay, now let us start with the main exercises. So the first exercise which you can do is shoulder flexion. Breathe in and breathe out. Breathe in. It very well help in chest expansion, so it also improves your breathing capacity. Okay, and breathe out. How many times? 8 to 12 times. Okay, and if you're comfortable you can even do the second set. The second exercise is fly exercise. You take it to the side, breathe in, breathe out. Breathe in from the nose, breathe out from. Remember, I'm not arching back. Okay, this will also help you to improve your posture. आपका posture better होगा, आप ब्रीदिंग बेटर कर पाएंगे और ऑफ कोर्स आपका आर्म स्ट्रेंथ बढ़ेगा। द थर्ड एक्सरसाइज वी विल डू इज अबडक्शन. ब्रीद इन, टर्न, ब्रीद आउट, ब्रीद इन, टर्न, ब्रीद आउट. ओके, ब्रीद इन एट 90 डिग्री आप टर्न करिए, ऊपर ले जाइए, वापस टर्न करिए, नीचे ले आइए. ओके, सो दीज आर द 3 एक्सरसाइज. वन वाज फ्लेक्शन, द सेकंड वाज फ्लाई, द थर्ड वाज abduction. Now if you are in the 3rd trimester and finding it difficult to stand and lift the weight, you can even sit with the back support and breathe in and take it all the way up. Breathe out, bring it down. Breathe in, take it all the way up, breathe out, bring it down. Similarly, you can take it out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. And you can do the abduction also. Breathe in, turn all the way up, turn all the way down. So breathe in, breathe out, breathe in, breathe out. Now if you don't have weights and you have resistance band, आपके पास weights नहीं है और resistance band है, तो आप हाथ को ऊपर ले जाइए और फिर नीचे. दोनों पैरों में आपने resistance band को लॉक कर लिया है. ऊपर breathe in, breathe out. Breathe in, breathe out. That is your flexion. Now for doing abduction, you will hold it on one side and you will hold it on one leg. Similarly on the other side. So your head and so when you are doing with the resistance band, then your repetition will be less. So instead of 8 to 12 repetition, you can even do 5 to 8 repetition. Now the next exercise is reverse fly. How much kg of weight you should use depending on how much you were using earlier. If you were not using any weight, then you should start using with 1 kg only. If you were using like 5 to 10 kg before, then you can reduce 2-3 kgs and start using it from the first trimester, and as you feel comfortable you can even increase the weight, but again reduce it in the third trimester. The next is basically reverse fly exercise. Your knee will be slightly bent, your hip will go back. You will not bend from the back, your hip will go back as if you are sitting in the chair. With that pose, your chest straight, your head straight. Okay, so you are not doing this. Your chest straight, your head straight. Breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. Again, 5 to 8 repetition. Okay, you can even do the second set if you are comfortable. Then you do the rows. So you bring in, if you are comfortable, bring both the hands together. If you are not comfortable, bring one hand at a time and then the other hand. Okay. After you finish the rows, there is triceps extension. So you go from rows to triceps extension. Okay. So your elbow bending and then straighten your elbow. Involve your triceps. Okay. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Again, 5 to 10 repetition is what you are looking at. You should be comfortable with the repetition. So repetition generally you will decide. Sets also you will decide how comfortable you are with the set. आप ही decide करेंगे कि आप कितने counts करने वाले हैं. चलिए फिर next exercise करते हैं. The next exercise is triceps extension. One hand at the back. You can do with one hand. If you find it uncomfortable or challenging, then you can use both the hands together and lift it up. Lift it up. Okay, so either you can do one hand at a time or both hands together. Triceps overhead extension. In the third trimester, you can sit and do this exercise. So you go all the way back and come all the way back. Or if you want, you can do with one hand first and then with the other hand. Make sure your elbow is facing the ceiling. Okay. And you are using your triceps muscle. Breathe in, breathe out. Don't forget to breathe. Next exercise is curl and press. So you basically curl, press, वापस, curl, press, come back, curl, press. Again 8 to 12 repetition. Do 2 sets if possible. 8 से 12 repetition करिए. 2 बार करिए अगर आपसे हो पाए तो. The next exercise, you basically put the resistance band somewhere which it will not come out and try to pull it towards you and relax. So squeeze your scapula and relax. Scapula कौन सी bone है जो पीछे है, तो वो सारी muscles को squeeze करिए. Okay. So row करिए, वापस row, वापस again 8 to 12 repetitions. So you can hold it for 5 seconds and relax. Okay, this is a very good exercise, especially when you are, when you will pull the baby up, all these functional movements will help you. So this is basically pulling your baby up. So next is wall push-up. We will do both triceps push-ups and the chest push-ups. The first is chest push-ups. So your both hands internally rotating, go all the way forward, come all the way back, go all the way forward, come all the way back. The next one is straight hands, go all the way towards your elbow and come all the way back. Elbow should be next to the chest, not going out in this. So both are different, okay? One is triceps push-up, the next one is chest push-up. How many you will do? As many as possible for you, and sets as many as you can repeat. So for the next position, you come into crawl. You basically squeeze your scapula, and so basically it retracts and protects the scapula. So that's all you need to do. So you will squeeze the scapula and come back. Squeeze it and come back. Also, you can do modified push-ups in which you are in crawl position itself, okay, and try to go down and come back, go down and come back. So these are the modified push-ups. So to improve your upper arm strength during pregnancy, these are the exercises which you can do. Do them as you are comfortable. Don't do overboard. Please consult your gynecologist and physiotherapist before starting this program and let them know what all exercises you are doing. It depends completely about your strength and stamina, so don't compare it with me or any other person who is pregnant. Do it as much as possible for you. Every exercise 8 to 10 repetition or 5 to 8 repetition and 1 or 2 sets. This will make sure that your shoulder doesn't get rounded, your curvature is not so much. Okay, also it will help you to improve your arm strength. So if you want to be a strong pregnant woman and you want to have a better labor and a better recovery post pregnancy, then do these exercises. We will also bring specific exercises for first, second and third trimester. Keep waiting, guys. Please subscribe to our channel Arogya Physiotips. If you don't do that, I'm not going to make videos for you. Okay, so please subscribe to our channel Arogya Physiotips and share our videos to witness your fitness with us.